we are here to share the status of children's rights in Kenya and of course the effects of COVID-19 on children. Among the key things that we are sharing today is what the children told us by themselves, and also what we reviewed from the government reports. All those 4 areas, government has made progress, but it has challenges. Many communities have no water. People are told wash your hands, sanitize, so there are families that do not have water and they can't afford sanitizer. That creates more risks. In the health sector, there are children between the age of 0 to 5 who ideally should have been going for the routine immunization and vaccination services. And because of the fear, they have stayed home for long, so we are worried that immunization indicators might have gone down. And that poses another health challenge. In terms of education, a number of children were not able to learn at home. Some were able to learn. So when they go back to school, clearly, in as much as government says that learning will start where it stops, their children will be left behind. But the mere fact that one parent was able to afford, another one did not, we see an element of inequality emerging.
It's important for us to note that children's rights are human rights, and decision making is an important aspect in the protection and promotion of human rights. We've developed a habit of thinking that what we think for people suits them best. That's not how it works.
Children have the same rights as adults for participation. And by the same way, government is inviting adults to present their views on public participation processes, either budget making or legislation or policy. We are concerned that children are saying they also want to participate, but government is not reaching out to them to participate. Previously, before COVID, they were able to participate through the children assembly or the school governments. Now that they're at home, the mechanism of participation is missing.
When decisions are being made, people need to be asked their thoughts so that they participate in a process that would lead to a decision which is being made that impacts on them positively. I think one of the things we have seen continuously is that decisions that are made without participation of children, in a way or the other, they are thrown out. One of the things we found on the survey, and which a recommendation we are putting forward, is that children must be involved in decision making on issues that affect them, because there are guidelines that are used for children in decision making.
There's glaring data around the status of violence against children. The government has the National Plan of Action. It's called the National Prevention and Response Plan on Violence Against Children. And the plan requires a multi-sectoral approach, so that plan needs to be implemented. And the community and parents and families also have a responsibility. Child protection starts at the household level, and unless a parent decides to protect their own children, you still have a problem. So protect your own child in your house, come together as Nyumba Kumi, protect your children, then protect your children as a community, and then, in case of support, then government comes in. And also children have a voice. Unless we educate children to be able to detect and report any forms of violation, we must also have a problem.
And issues that affect children are numerous, from education to food to health, all those. Whenever these decisions are being made, those guidelines that have been put forward on children participation in decision making must be followed, so that we do not have cases where decisions are made, and then when it comes to the point of implementation, you find that children don't identify with them. And if they don't identify with them, they rebel. If they rebel, you find that you engage in a futile process. As we think about interventions, we must think about children and think about their best interest. We must put the best interest of the child to guide all our processes on things that will intervene for them.